Welcome to episode number 89. This is Making Empowered Choices in Pregnancy. Today, I would like to share with you a beautiful and intelligent way to make empowered choices throughout your pregnancy using the BRAIN acronym. This is something that I personally had to come back to near the end of my pregnancy, and so I will break down how to use the BRAIN method when making choices for yourself and also use my personal experience as an example today. As I record this episode, I'm 36 weeks pregnant. I'm pre-recording episodes in advance so that I can stay in your ears week by week throughout my postpartum period. So about a week ago, when I was at 35 weeks pregnant, we discovered that our baby girl was relaxing in the breech position. So that's bum down, head up, or as I like to say, her head is up near my heart. An ideal optimum position for birth and at this point of the pregnancy is essentially head down, bum up. Although, baby goes where she wants to go or where they want to go, and they take their time as well. There shouldn't be a strict time pressure put on babies to get where they need to go too early. So initially, when my midwife found that baby girl had her head up near my heart, there was some monkey mind stress around this because I am a human and I do have a monkey mind. So there was a bit of stress until I turned and tuned back into what I knew and what my intuition and my baby was telling me. Our priority at this point was to support my body to encourage her to turn into a head down position when she's ready. And I've been encouraging this gently by practicing meditation, visualization, moxa, and stretching, including lots of forward-leaning inversions. I'm talking to her, we have a divine connection, and I know that she has lots of time and space, and I trust that she is doing what she needs to do. Considering that I had the support of a private home birth midwife and an amazing doula, I was able to feel peaceful with the situation in trusting that she would turn when she is ready or not, and maybe she just wants to enter the world breech style. So I am very, very grateful that I had options and support around me because I'm very aware that not everyone has that level of support around them and not everyone knows that they have options. If I was within the medical system in this situation, it could be a very different story. There would be a lot more fear-based and risk-adverse advice given in this kind of situation. A lot of pressure, and particularly pressure based on timelines, like your baby has to be here by this date. Babies don't follow timelines. How does it go? Babies aren't library books, they're not due. Babies aren't pizzas, they're not delivered. So in this situation, at this point in my pregnancy, in the medical system, the pressure would be to possibly make a decision based on an intervention, like an ECV, which is an external cephalic version, which is basically when an obstetrician manually turns a baby around with their hands. And side note, I think there's about a 40 to 60%, it's very vague, success rate for an ECV, because usually the baby just turns back around where they were before, and there are risks associated with moving the baby around, like interfering with the umbilical cord or the placenta as well. I would also be posed with an elective cesarean, and usually when this option is given in terms of breech, they do like to schedule in the cesarean preterm or at term, not allowing the baby sufficient time to potentially turn around by themselves, because babies do turn up until the last week of pregnancy, or least likely within the medical system, I would be prepared for a vaginal breech birth. Often that is simply not an option, and women are not supported within the medical system because there is not sufficient training, and there's a lot of misinformation about vaginal breech birth. So I like to use this example because I want you to know that knowledge is absolutely power in situations like this in pregnancy. Consuming the right knowledge based on current evidence can allow you to feel confident to move past the fear-based suggestions and the language used to make an intelligent, intuitive, and empowered decision. You can use the BRAIN acronym for any small or big decision in pregnancy. There are also incredible evidence-based resources available around decision-making in pregnancy from women like Dr. Sarah Wickham and Dr. Rachel Reed. So let's break down the BRAIN acronym. B is for benefits. Firstly, you're asking, what are the benefits of making this decision? Essentially, these are questions that you can pose to your obstetrician or your midwife, or you can come back and ponder by yourself in your own time. So for me, when it came to the benefits, if it did come to extra ultrasounds, a potential ECV maneuver, or talk of a scheduled C-section, I personally found it hard to find any benefits that outweighed the risks to me and my baby at this early stage. The R in BRAIN stands for risks. So really important one to ask, what are the risks involved in this decision, in this procedure? I personally weighed up the risks of an unsuccessful ECV, as well as short and long-term effects of a term C-section, and the stress and the pressure of the entire situation throughout my pregnancy. The A in BRAIN stands for alternatives. You can ask, are there any alternatives? Keeping in mind that you may not get the answers that you need from certain people who have certain points of view. So you may need to seek out your own alternatives. There were many alternatives in my personal situation. Firstly, to settle my monkey mind, all of the evidence tells us that 1, babies turn until the last week of pregnancy, and 2, vaginal breech birth is a safe variation of normal when supported physiologically. So those were my alternatives. And I also did beautiful body work with a doula, moxotherapy, moxibustion, which is a form of traditional Chinese medicine. And I connected with my baby girl energetically every day. The I in BRAIN stands for intuition. What is my gut telling me? This is massive. Your motherly intuition is incredibly important throughout pregnancy, birth, and postpartum, and it's really easy for it to be clouded. My intuition was so strong on this, and when I actually tuned into it and listened to it, I felt at peace and I knew the answer for myself. It wasn't so much the circumstance that was stressful. It wasn't the actual thing that was happening, but rather what that meant for me within the system, rather the consequences and the stresses and the pressures that would be put upon me. And lastly, the N in BRAIN stands for nothing. What if we do nothing or wait it out? As mentioned, this was a sound option for me to do nothing, to not intervene unnecessarily or too early, and to trust that my body and my baby know what to do. One thing that my husband and I learnt throughout this experience is that no doctor or midwife really knows our baby as well as us. We were feeling her every day. We could feel her size. We could feel her movements. She was in my body. My husband was very aware of what she was doing. We were very aware that she was moving around a lot, that she had time and space. And I don't think that one person in one visit can necessarily override that level of intel that we personally had. So this is where you can combine, evidence-based information and your strong intuition and inner knowing. So that is the BRAIN acronym. B, benefits. What are the benefits of making this decision? R, risks. What are the risks involved? A, alternatives. Are there any alternatives? I, intuition. What is my gut telling me? And N, nothing. What if we do nothing or wait it out? And my last add-on to this, my personal add-on, is time. It can be very difficult to ask a doctor or challenge a midwife in their own environment or on the spot with these tough questions. I know that my brain always needs time to process things and to pose questions and to look into things. And even if you can on the spot, you may not get the answers that you deserve. You may not get the fair and just answers that you're looking for. They may very likely be biased based on the environment and the experience of the person. So you do not need to make a decision on the spot ever. Like I said, I found that I needed to process, research, and then tune into myself before I felt confident with my decision. So take your time and come back with more questions or an answer when you are ready. My only hope is that you are able to follow the evidence and follow your strong motherly intuition when it comes to hurdles and decision making in your pregnancy, that you can make empowering decisions that aren't fear-based, remembering that ultimately you as the mother should be leading the pregnancy and you should be the main decision maker. You are the only one in your body with your baby, so you do know best and you can say no. Here's to an empowering pregnancy. I'll chat to you next week.